New information tonight as a major hospital is cutting jobs and in a matter of months will no longer deliver babies at that facility. Johnson Memorial Health is dropping its maternity services. Now mothers-to-be will have to find a new place to welcome their bundle of joy. For the first time since 1947, new life will not be delivered at Johnson Memorial Health, the hospital phasing out its maternity services over the next few months. 48 people, including doctors, nurses, and other staff, were notified of the decision on Friday.
And I'm angry. I'm angry about what the system, I'm angry that not enough has been done to change it. And I feel horrible for those mothers that are going to be delivering in the next 3 to 6 months, this uncertainty.
A major contributor to this situation is Medicaid reimbursement. The hospital reports that for every dollar it spends, it only gets back 57 cents. Over time, that's millions of dollars in losses. According to the hospital, 40% of their mothers-to-be depend on the government-funded insurance. JMH estimates that its annual losses have reached $2 million. The hospital also points out that those losses and the daily challenges from insurance companies on their claims have created a difficult time to keep the door open to vital services.
The leadership of these insurance companies, their fiduciary responsibilities to their shareholders. It's not to the patient to be sure that they get the care that they deserve or have paid to receive. It's not to the hospitals that provide that care. Their fiduciary responsibility is to their shareholders. That is it. And when you look at the record profits that these insurance companies have made, while hospitals continue to close across the country, something has to change.
The Indiana Hospital Association represents 160 facilities across the state. It's sounding the alarm. Last month, the group released a study warning that hospitals in Indiana could lose $1 billion every year over the next 3 to 5 years, which will likely trigger more layoffs and cuts in essential services.
Hospitals can't survive on 57 cents of the dollar. Something has to be done, and the time is now.
By the way, families in Johnson County will still have places to deliver their babies nearby, with hospitals in Shelbyville and Columbus, as well as indie hospitals like Community South and Franciscan South, all in the area.